Relate exactly to what Angelina Jolie was going through. Kristen, thank you for being here. And what did you think when you saw Angelina Jolie go through this?
You know, a lot of women think that she was extremely courageous and brave, and I personally have walked her walk and think the same.
Yeah, because Kristen has had a double mastectomy. Now, how long ago did you have your procedure, and how are you doing now?
I'm doing great, absolutely great. My procedure was about 2 years ago in February. And, you know, I feel great, but you have to work at it. You got to keep yourself healthy. It's
not a sudden you have the surgery and, you know, a couple months later you're just back to normal. Now, Angelina Jolie today revealed that it was because of her children and wanting to be here, as well as her history, that she made that decision. And it was about family for you too. Tell us your story.
It was. My mother died when I was 12 and my sister was 7. And she was 39 just for a few weeks.
We have some pictures actually of your family that we're going to show. But yeah, your mom died. You were just a little girl.
I was a little girl. And then a few years ago, my sister, the week she turned 35, was also diagnosed with breast cancer. And that was the point. That's my mom.
Okay.
About 30 years ago. And then my sister found out she had breast cancer just about 3 years ago in August. And we then discovered that we carry the BRCA1 gene mutation, which gives you an 87% chance of developing breast cancer and a 48% chance of developing ovarian cancer.
Was it, even with those odds, still a tough decision to make?
You know, it can be for women. It really can be. I heard someone describe it as, imagine you're boarding a plane and the stewardess says there's an 87% chance of you not getting there. What do you do?
Yeah.
And it's just a personal decision. You have to really use your doctors and your geneticists and make good quality decisions for you and your family.
You know, I know when I was diagnosed with breast cancer, early on I told the surgeon, you know, just cut it off, because it was my left breast. And I said, take it off if that's what we need to do. And he said, you know, I don't think we need to. So I just had a lumpectomy, but I was there too. I was ready to do it. I mean, it's just, you know, you had replacement surgery right away, and you're doing great. Now tell us about the testing. There's 2 different tests, you said.
Yes, well, I was offered a way to test for the gene was either a spit test, which is a little bit of scope and actually just spitting into a cup, which that was the one I chose, or you can do a blood test also.
So when you got those results, were you shocked?
With the strong family history, I wasn't sure, and it's important to know that only 5 to 10% of breast cancers are actually hereditary that we know of at this point. My husband was probably the most devastated I've ever seen him, and the scariest part is that we have 4 children, and so they each have a 50% chance of carrying the gene also.
So where do you go with that thought? I mean, you're just concerned for your family. They're a beautiful group of
They are.
people.
And you know, I guess I chose all the surgeries to show that you can live through it, and you do the best you can, and you do the most you can, and you know what? I've lived 4 years longer than my mom, and I'm here today, so I'm grateful.
And we are glad that you are here today, and you too are an inspiration for us and for all those who are listening. We did actually want to bring in a medical expert to join this conversation. Jennifer Klemp is director of the Kansas Survivorship Program at the University of Kansas Hospital. She couldn't be here, so I wanted to get her insights, because this is a medical decision too. All right, so Jennifer, thank you for being here. Yes. Tell us, are more women, since the Angelina Jolie story, getting preventive, you know, mastectomies to prevent breast cancer?
I think what's happened since the story broke, and there's been so much media obviously around that decision, the pros and cons around the decision, we've had a slew of calls coming in asking for consultations to discuss what are their options. So I think that that's a really important thing as a take-home message, is that women aren't calling and saying, I want to have bilateral mastectomies. What they're saying is, I really want to explore what my risk is, and might that be an option for me?
So who should get a bilateral mastectomy?
I think that's obviously a cost-benefit ratio where we have to take the patient's preferences and their risk into consideration. So the first thing would be a woman, obviously, who has a strong family history. Maybe she's also had prior biopsies. So we really want to have a woman who's undergone good genetic counseling and had testing done in their family. We know that there's a genetic mutation which increases that risk significantly, from 50 to 87% chance of getting breast cancer by age 70. And then, by using that risk-reducing strategy, they can take that risk down to less than 10%. So it needs to be a woman who's at that highest level of risk.
All right, so good information there. Thank you so much, Kristen, for being here and for sharing your story as well today.